Vallejo gym is letting members know they might have been exposed to tuberculosis. The Solano County Public Health Department is now notifying people who belong to the 24-hour fitness on Sonoma Boulevard in Vallejo. A person who contracted the disease there was a member of the gym. As a precaution, the county wants to make sure all members who were in the gym at that same time as that person are notified.
Well, they sent everybody emails yesterday, and they just basically said that there had been someone that was here that has tuberculosis, and the health department advised the 24-hour to email everybody, and they did.
Health officials say the bacterial disease can only be contracted through the prolonged close contact with an infected person, and it is safe to visit the gym.
Okay, so let's talk more about tuberculosis and the concerns surrounding it with our health expert, Dr. Larry. So, Dr. Larry, explain a little bit more about what tuberculosis is and how it spreads.
Tuberculosis it's between a bacteria and a fungus. It spreads by respiratory droplets, but it's not as contagious as a cold. You mentioned earlier you have to be close contact. So we typically think of like homeless shelters, jails, or when someone's infected, the people they live with. So somebody passing through here, if they coughed on you, you're probably not at you're at some risk, but not that high a risk of getting it.
But at a gym, higher risk?
Again, like it's close, frequent contacts to get this. It's a slow-growing fungus bacteria thing. So it's not as quick as some of these viral things. It's a maybe, right? That's why the public health officials want everybody to get tested if they were potentially exposed.
Okay, so let's say I'm a member of that gym. What should I do?
Well, I don't know what they have to offer in terms of is the public health facilitating this, but go to your doctor or go to the public health that they have there and get tested to see if you have what's called dormant tuberculosis. So you get exposed to it. Some people, their body fights it off. Other people, it fights it off not 100%, and that disease can lay dormant for weeks, months, years until it activates into pulmonary tuberculosis or an infection in the lung, which is what this guy had when he was there working out, and that's what's contagious.
Okay, so in this case, we understand that the person infected hasn't been at the gym since May. Does that mean that it's still lingering in that facility, or that there are any risks with going to the gym now?
No, TB is not going to live on the treadmill or anything like that. It makes me wonder, you know, how long was he symptomatic? Was it April and May that he was coughing? Did you go to the gym at that time? Did you work out when he worked out? That kind of thing, if you worked out next to him. Those are the people that would be at high risk for that exposure. Okay,
so what do we do? How do we prevent it?
Well, if you were exposed in this case, go to your doctor or public health, get the test. There's a skin test. If it's positive, then you get treated for 6 months with one pill. It's done. In terms of prevention, this is a public health issue, and that's why I like to see them being in this country. Public health being aggressive for TB, meaning tracking down people like this, giving them the option to get tested and treated, and then this guy will be quarantined. So he's not going to be allowed to just walk out with active TB and go to the grocery store and go to the gym. He needs to either stay at home or be in the hospital and be treated until he is negative for TB with these tests we do.
Got it.
So that's why in this country we don't worry about TB a lot. I mean, there's, I think, 12 million cases active worldwide, mainly in the developing country. Their poor public health is why that disease is rampant. You know, here, being aggressive like we do with public health, that's why we don't have to worry about TB.
Yeah, letting people know and letting people know what they should do. All right, Dr. Larry, always a pleasure to have you here. Thank you so much.